Please join me in welcoming Carlos Jackson to the stage.
I am going to bring you the perspectives of what's happening in federal health policy from Washington, D.C., but I'll be bringing you this information as someone who is from Northeast Ohio, who grew up in Cleveland Heights, go Heights, and also lived here in the Cleveland area for a couple of years when I worked for Cleveland Clinic. But I'm back in Washington, D.C. with my family, but this is home, so I'm very happy to be home. So thank you, WellLink, and I'm just very pleased to be with you all this afternoon. So I'm going to jump in and give you a sense of, again, what's going on in Washington, but it's really appropriate to level set right now. Last year in 2025, there was this very big legislative effort in Washington in Congress called One Big Beautiful Bill. It was a budget reconciliation bill. Reconciliation is a very complex process in terms of passing legislation through Congress. I'm not going to get into the details about that, but essentially think of a party line vote. And that is one of the only ways in Washington to get major legislation through. It's not just the Trump administration that takes advantage of this process. Also, Democrats do the same thing. So when you hear about the Inflation Reduction Act, when you hear about the Affordable Care Act, those were also huge legislative initiatives that were passed through this narrow legislative process that allows for only party line votes, and that's most important in the Senate. But those votes and those policies have consequences. And so we're going to walk through what it means right now. In Washington, the landscape is really geared towards healthcare coverage. And when we think about the policies that were passed and signed into law last year, they will have a significant impact on healthcare coverage. Now, the President Trump, his administration, they wanted to make some significant changes to the Medicaid program. Those changes translate into significant cuts to the Medicaid program. And Ohio, as most of you well know, will be on the hook for major reductions in federal Medicaid funding for the foreseeable future. Those cuts will not begin until 2028, but the process is underway today. So we know that when it comes to statewide, we're looking at a reduction of around 350,000 Ohioans who had Medicaid coverage who may lose that coverage. And here in Cuyahoga County, that could be a little bit, around 35,000 folks who could also potentially lose their Medicaid coverage. So when we think about what's happening today, higher costs through inflation, other foreign entanglements like the Iran war, Americans are paying more. When you think about your health, you're also paying more for your health care. One of the ways that you can afford health care is through health coverage. And so federal activities to reduce health coverage will have an impact on the pocketbooks and wallets of Americans and many Ohioans that you, or some of you, may know today. So when we think about this landscape and the notion that you will have more Americans without health coverage, what does this mean? For policymakers in an election year, they want to respond. And part of that response is really answering the questions that voters may have of, what are you doing for me lately? Well, if you think about last year in 2025, the response will be, in some cases, make your coverage more expensive or make it harder for you to maintain that coverage. That's what some folks will say. At the same time, at the federal level, the government may say, also thinking about the ability to ensure that there will be federal health coverage products available and that the country will be able to afford it. That tug, that push and pull, is a dynamic that Washington never quite gets right. They're trying to get it right, but at the same time, it's pretty tough, and you bring politics into all of that. So when we think about, again, One Big Beautiful Bill, which is a very funny name, I'll give the president this. He is a marketing person, and he does have a way with catchy names. Now, whether or not they're beautiful, I'll leave that to you all to figure out. But One Big Beautiful Bill is this legislation that did produce around $1 trillion worth of Medicaid cuts. That is a very, very significant figure. And again, that will have an impact on the Ohio budget as well of not being able to draw down as much in federal Medicaid funding. Hence, again, the reductions that will be experienced here in the state over time. Most of those reductions are going to be through policy changes, such as Medicaid work requirements, which we know the state legislature and the Ohio Department of Medicaid are working through right now. There's one state nationally that has already implemented their work requirements. That is the state of Nebraska. And there are also policies or just certain circumstances in life that will allow those who are dealing with, family health crises or situations where there are economic hardships to be exempt from some of these policy changes, but work requirements are going to be a huge source of the Medicaid savings that are part of this law. In addition, there are changes to how states finance their Medicaid programs through very complex avenues like provider taxes, state-directed payments. Those levers will be reduced as well. So think of the federal government as turning the dial down on the amount of Medicaid funding that they are providing to the states. So again, significant impacts here. This is where the money is coming from. Those savings will then be held by the federal government to maybe do other things. What those other things are, I can't answer that question for you. I'm not in charge. And I'm happy not to be in charge. But when we think about the Medicaid changes that are coming, just on the slide in front of you, you'll see a timeline. And the most significant Medicaid change that will be coming will take effect on January 1st of next year, so 2027. That will be the work requirements. However, when you think about how a bill becomes law, and we think a little bit about Schoolhouse Rock, I think some of you in the audience maybe remember that. I don't consider myself old, but Schoolhouse Rock was the best. You know that for a bill to become law, it does have to be implemented. And so when we think about the regulations that are coming, some of those will come on June 1st. That will be the federal regulation for the work requirements. So we'll have a better idea of how that will look, how that will be implemented, and what it will mean for the states. But the states have a major stake in this. The state will be required to implement the work requirements, but also ensure that the Medicaid program continues to operate. Also, they will have a lot to work on when it comes to verifying the folks who are eligible for Medicaid coverage, to ensure that the right people are on the rolls, the right folks are enrolled in the program, et cetera. So major changes are coming, but the pain, the economic pain will be felt in 2028, just around the time for the next presidential election, but it will be after the 2026 midterm elections in November of this year. So that is a key point to make. When Congress and the administration established this law, they did so in such a way that the major changes would happen after November of this year. Of course, we're all cynical about politics, but that was the reason why it was drawn up that way. Get beyond the elections, not have the pain hanging over the heads of those folks who are on the ballot in November, so they're not dealing with the output or the outcry, depending on who you are. So when we talk about work requirements on the screen in front of you, some of you may be very familiar with the exemptions and how the work requirements will work. Again, the state of Ohio is still working through that process. I'm not a state guy, so if you have any questions about the specifics of what's going on down at ODM or the legislature, I can't answer that for you. I can do some homework and maybe answer questions sometime after the fact, but not so much for this particular conversation. But these are some of the criteria that have been established by the feds, and now the states will have to fill in the blanks. Now, when we also talk about One Big Beautiful Bill, there was an attempt to make changes to the Affordable Care Act. And also the Affordable Care Act is the avenue for private health coverage, as some of you know, and you're able to go, for those who buy coverage through the Affordable Care Act, on the online marketplaces, go out and pick your health plan. Now, what One Big Beautiful Bill did was make it a little tougher for certain folks to be able to purchase private health coverage through the online marketplaces. So that's one avenue. Also restricting access for certain legal residents who are part of this country right now. But when you take the Medicaid changes in One Big Beautiful Bill combined with some of the changes to the Affordable Care Act marketplaces, it seems like unfinished business was taken care of here. And I think back to 2017 when you had repeal and replace of the Affordable Care Act. At that time, I was at Cleveland Clinic, working in federal government relations, also state government relations, and we were very concerned about the level of Medicaid cuts back then in the attempt to repeal the Affordable Care Act. If I recall, it was around $700 or so billion worth of Medicaid cuts in that law. That did not pass. It was the famous occasion when John McCain, former Senator McCain, walked to the Senate floor and did the thumbs down. That was the end of repeal and replace. However, you can think of this effort, One Big Beautiful Bill, as a continuation of it. So when we think about Medicaid expansion, major changes that were done there in the law, also financing of Medicaid programs for states, major changes done with this law, but then also taking a look at the Affordable Care Act marketplaces and restricting access to coverage and lowering the ability of some folks to take advantage of these subsidies that will help them afford private health coverage. So I call it a little bit of unfinished business, but this is the government that we elected in their control, and they have different set of priorities than what the Democrats had. Now, moving forward, I kind of explained a little bit about this, so I'm going to skip this slide and talk a little bit about the enhanced premium tax credits. So this is another element of the Affordable Care Act. Again, subsidies and tax credits that allow Americans to be able to afford the private health coverage. When former President Joe Biden was in office, one of his first major acts was to increase the income threshold for families to take advantage, or individuals and families to take advantage of premium tax credits for the Affordable Care Act. And so they're called enhanced tax credits. Well, those tax credits expired at the end of this year. But what that meant, or end of last year, sorry, end of 2025. But what that meant was that folks who were able to get a little bit of a helping hand to afford their health coverage, that helping hand was no longer available to them. So that will also have a significant impact on the number of Americans who have health coverage. There was an attempt, a bipartisan attempt at that in Congress to get those tax credits extended. That did not happen. Again, a little bit of politics involved here. And I know for some Republicans that the thought was, why should they be working to help an initiative that was put forward by former President Obama and then extended and enhanced by former President Biden? Thinking about it in that context was not really a non-starter for many Republicans. There were other Republicans, though, including some of the Ohio congressional delegation, who did want to see these policies continued because, again, it was an affordability concern. This is one avenue where folks can keep more money in their pocket and spend less on their health premiums and less on their health care. But again, Congress did not act, and so we are where we are. And one other element around the One Big Beautiful Bill is the funding for rural health care. Now, one of the concerns when this was all being pulled together was that the impact on rural America would be severe. Again, we're talking major Medicaid cuts that I've already walked through, and that would have an impact on coverage and also access to care in those rural communities. So one of the solutions that Congress came up with was to provide a pot of money, in this case $50 billion, which would be spread out to all the states, just the states in the U.S., not any of the federal territories. And this money would be allocated to each state, where states would apply and then develop plans to improve healthcare in rural America. So the Rural Health Transformation Program is up and running. Ohio is going to receive, over time, over 5 years, $202 million from the federal government for this program. Ohio has put forward their application. The federal government will review the application and then approve the money that will be distributed. So on the slide in front of you, I'm not going to walk through all the details here, but you see some of the criteria that's involved here. But think of workforce, investments in technology, and also stabilizing some of the rural providers that are available in communities across the state. And this is just a little bit of a snapshot of how the federal funding is being distributed. It is not an equal share of money to each of the states. Some states are receiving more than Ohio. There are many states that are actually receiving less. So it's kind of a political process. And I will say one of the levers to getting One Big Beautiful Bill passed was the sweetener of going to certain senators or members of the House and saying, hey, we can kick more money over to you to help your rural providers if you vote yes for this bill. So again, not to be a cynic, but this is the way sometimes major legislation gets done. There are certainly lots of deals, but you and I will never know what those deals are because they're private, and they will not see the light of day. So I talked a little bit about the context of where we are to bring us to this point. And at this point in time, it is all about affordability. We know Americans across the country, let alone many of Ohioans across the state, are very concerned about their bottom line, their personal bottom line for themselves individually, and then also for you who have families. And so when we think about what is the government that we've elected, what are they doing for you, it's all about affordability. don't want to dig deeper into your pocket to pull out what money you have to spend on healthcare and other items. You want to keep as much as you have in your pocket. And so in this context, in this election year, polls are telling us that, again, it's the economy that Ohioans and Americans are most concerned about. And there are many factors that are happening out there right now that are not doing anything to really help you in terms of making sure you're keeping extra dollars in your pocket instead of digging further to find them and then subsequently spend them. So healthcare is one of the issues that Americans are most fed up about. Yes, we're all paying more for gas. We fill up our tanks. The gas prices, because of the Iran war, are very, very front and center and top of mind for many of you, including myself. But also when you think about how can you afford if you or one of your loved ones gets sick, do you have the ability to pay for it? Does your health care cover the procedures or services that you will need to get better? And the answer for most Americans that they feel is actually no. And so when I walk through the changes in one big beautiful bill and what has been done, again, not much to improve the financial situation for Ohioans and Americans as it relates to their health care. So when we walk through some of the polls here and just want to give you a snapshot of what voters are thinking, you see where health care, again, is number one, health care costs specifically. And so in poll after poll, Americans are demonstrating what they're going to be voting on come November, when control of Congress is at stake, which then will set up what will happen between now and the next presidential election in 2028. It's a very pivotal time, and I feel like every year now we're saying it's a pivotal time, but it's very true. And so for the politicians that you are all electing to send to Washington, D.C., the question that they're trying to answer for you when you ask them is, what have you done for me? They're trying to say, we're going to do something for you, because they are reading these polls here. They see them, there's a lot of angst, and they are reacting, and I'll get to those reactions here shortly. But again, just walking through some of the slides here, this is all pretty self-explanatory. I think you all could probably answer some of these questions if you haven't already, if you've been contacted by a pollster, but you know exactly where you stand when it comes to healthcare costs. And one of the central planks for the current Trump administration is the notion of Make America Healthy Again, or MAHA. And so there's been a lot of attention that's been placed around healthcare as it relates to the food that we're eating, which we understand very well here in Northeast Ohio, but then also some of the environmental factors that impact health as well. But when we think about that, having better access to healthy food, not having overly processed food being a central part of our diets, although of course it is. When we think about those important factors, we all want that to be better for us and also our family, particularly the kids, when we think about our children. But before you can get there, you have to be able to afford it. So again, in that context, even though MAHA is a political movement, it's a very activist movement, Make America Healthy Again, even members of that demographic are telling politicians today, this is all well and good. That's great that you're focusing on making us all healthy again. But really at the end of the day, what we care about is making things cheaper. And that also includes healthcare, your healthcare premium, the bills that you get from your providers, and what you're spending on prescription drugs and other services. So from a political standpoint, this makes politicians very nervous. Because again, one big beautiful bill, significant impact on health coverage, a significant impact for some Americans on their ability to afford their health coverage. Their premiums are much higher than they were a year ago. So when we think about elections and we think about the issues that voters care about and we think about which party is stronger on those issues, traditionally Democrats have been the stronger party when it comes to health care. Frankly, American voters trust the Democratic Party to do more on healthcare issues than Republicans. And so Republicans have a very fragile majority in Congress today. It's a very slim majority in the House, and it is a slim majority in the Senate. And so when an issue that they are playing defense on is top of mind for voters coming into November, again, there's a lot of sweating going on here. And I'll get into the politics of all this later on in the presentation, but it's pretty fascinating. So to prevent some of the pain that could be coming for Republicans electorally, they do want to pay further attention to healthcare and healthcare costs. But I do want to talk about where some of the solutions may lie. And again, for the Republican majority in Congress, they're going to look for solutions of lowering healthcare costs in a couple of places. They are going to address healthcare coverage. They are going to look at reducing prescription drug prices, but they're also going to focus on the role of providers in driving healthcare costs. And right now, I will say hospitals, particularly large nonprofit hospital systems, are under the microscope at the federal level in a very, very intense way. I just spent all day yesterday dealing with draft legislation that was released that was kind of a surprise that would target nonprofit hospital systems, and it may be considered in the committee in Congress next week. So I'll talk a little bit about that in another minute. But the reason why providers are a focus for policymakers right now is what you see on the screen in front of you. One of the key drivers of higher healthcare costs are hospitals. And I say that as someone who has spent almost the past 20 years working exclusively with hospitals. I've worked for them, I've been an advocate, still am an advocate for hospitals, but we see the numbers, you see the data, and you see a lot of the media articles that have been written for the past 5, 10, 15, 20 years, all pointing back at hospital billing, charges. We've all been there. We all get it. So when the growth of federal spending or national spending from hospitals goes up $1 trillion over the course of a couple of decades, again, this is a good target for policymakers, and it is a target that is ripe in front and center today. So what is it that our federal policymakers are doing about it? For the Trump administration, there is the Great Healthcare Plan. First, there was one big, beautiful bill. Now the Great Healthcare Plan. This isn't much of a plan. It was a speech with a fact sheet that was put out by the White House, and there are no further details than that. No legislative language, no proposals in Congress that would represent the entirety of this plan. But the president is articulating, again, to answer the question of voters, what are you doing for me lately? He will say that, number one, his administration is making access more available, making it more available for Americans to have access to lower cost health coverage. What does that mean? Health coverage with a lower premium, but a much higher deductible. He will also say that he's working to lower prescription drug prices, particularly through these private agreements called most favored nation agreements. His administration has been working individually with drug companies to come up with agreements where they will sell drugs at the same price that they're being offered in certain countries overseas to Americans. We don't know what's in the details of these agreements because they're all under lock and key. They're private details, but for his plan, he would like Congress to codify, basically pass legislation to codify in law these agreements. Again, devil's in the details. We don't know the details, but that's one part of it. The other part that would target providers is transparency. They're looking for stronger price transparency laws because the goal for Republicans is that Americans would have access to data in terms of prices where they can shop and figure out where they want to go for quality care at a lower price. That is one of the goals for this administration. And right now, federal regulations and laws don't allow that very well. So those are certain elements of the president's great healthcare plan. In addition, the president did open with great fanfare the TrumpRx website. So the administration's in the game of direct-to-consumer pricing for prescription drugs. So here's where Americans who, for those who don't have health insurance, really, this platform allows them to get access to cheaper prescription drugs. If you have private health coverage, say through your employer, frankly, it will be cheaper for you to get drugs through that health plan than through TrumpRx. That is simply the truth. So on the screen here, you might not be able to see it, but you can see and get an idea for some of the key drugs that are available through TrumpRx, what the price will be. But again, if you are a person who does not have access to health coverage and you're looking to spend cash out of pocket for drugs, the president, in a very clever way of marketing, put this out there. So if you are an American and you're thinking, what's the president doing for me? You can go to that website and take a look at it and see. So that's for lower drug prices. In addition, I want to skip this slide, sorry. In addition, the president and his administration is actually making access to health plans, cheaper health plans that do not have contracts with providers, certain hospitals, certain physicians, certain benefit terms. So think of them as kind of more stripped down health coverage. But those plans actually qualifying to be listed on the Affordable Care Act marketplaces. So this is kind of an end around where you take advantage of the structure that's in front of you, but provide plans that may not be quite as robust as what say a Democrat would like, but again, for the family or individual that simply wants that measure of protection for health coverage without paying much upfront at least, you have access to those plans. Now the rub here is that if you do get sick or someone gets hurt, then those plans don't cover everything, so it's much higher out-of-pocket cost for the patient and consumer in terms of a higher deductible, and again, paying themselves for certain services that are not covered. That is the trade-off, if you will. But the administration, again, is making it a lot easier for these types of plans to be made available to Americans. And so when we think about stakeholder reactions here, of course, we have hospitals, you have health plans, you have drug companies. They're going to be on different sides of some of these issues. But one side where you have health plans and providers aligned is this notion of making it more, more bare bones coverage available. And so in the slide in front of you, you see some of the major industry groups for hospitals and health plans who come together in opposition to the administration's changes for certain health coverage options. Again, we've talked a lot about price transparency, and this has been a consistent theme for the Trump administration going back to the first term and also in this term. In the first term, the administration put forward regulations that required hospitals and health plans to provide plain language data on their websites in terms of what the charges would be for certain services. The compliance on this has been very low. The administration is not very happy about that. And so they're going to push even harder to get hospitals and physician offices and health plans to provide clarity in very, very plain language of what it means to go to a hospital or a outpatient surgery center, ambulatory surgery center to get a certain procedure or service done. Again, the goal here is to be able to look at the price, compare across different providers, and then go to where the provider that's best for you in terms of quality and price. They want to increase competition in this way, lower overall spending when it comes to healthcare in this manner as well. And also waste, fraud, and abuse. That was one of the big catchphrases in the development of the One Big Beautiful Bill. Many of the Medicaid changes that I spoke to at the very beginning of this presentation were put forward in the context of reducing waste, fraud, and abuse at the federal level. That is still a major focus of this administration. Just yesterday, Dr. Oz, who runs Medicare and Medicaid for the federal government, and I'm sorry, I still laugh at that Dr. Oz is the person running Medicare and Medicaid for us, but he did make an announcement that they're going to withhold $1 billion in Medicaid funding for the state of California because the state of California has not produced enough information and data to show that they are doing everything possible to reduce fraud in their program. In this case, it's targeted towards hospice providers, and this has been an area of focus for Dr. Oz for the course of this year so far. In addition, the administration has put forward letters to each state asking for data and information on how the Medicaid fraud control units in that particular state operates. So this administration, one of the avenues that they're looking to take to reduce healthcare costs is to really attack fraud, and not attack it on the back end after fraud has occurred, but actually attack it on the front end so that it does not happen in the first place. So this is a major focus for them. Also, I would be remiss just not if I didn't note that the DOJ, the Department of Justice, is also suing certain hospital systems for what they consider to be anti-competitive business practices. Again, nonprofit hospitals have been a source of friction and concern for the Trump administration and some Republicans in Congress, frankly. And so one of the areas they're looking at is for the bigger hospital systems, looking at essentially their bargaining or negotiating power when they contract with health plans. And so there have been suits filed against a hospital in New York that's actually run by a former Cleveland Clinic leader, and they've actually filed suit against one of the hospitals here in Ohio, Ohio Health down in the Columbus area. So this is an area to keep a look at, because the administration is drawing a line between business practices from certain large hospital systems and the amount of money that each of you are paying out of pocket. They draw a direct line between the two, and they're attacking it right now. So when we think about Congress and what they're doing around affordability, right now there's been a number of healthcare hearings in both the House and the Senate to take a look at healthcare costs and what Congress can do legislatively to bend the curve in the way that would be most helpful to voters. Again, one big beautiful bill is one that is not helpful for them, and the polls are showing that today. So you're seeing health plans, prescription drug stakeholders, and actually hospitals being hauled up to Congress in showing, or at least trying to demonstrate to lawmakers what they're doing to keep costs low for patients and consumers. Some of the hearings are a little uncomfortable, and hospitals had their day in front of the House Ways and Means Committee about 2 weeks ago. You did not have a panelist from Ohio, but you had a hospital representative from New York, from the largest Catholic hospital system based in Chicago. You also had the largest for-profit hospital system in the country that was before the witness panel, and then a hospital system from rural America as well. Each of those CEOs had to defend some of their business practices, or in other cases, make certain commitments of what they're going to do to reduce costs and charges. We'll see where this goes, but we do know that they're looking at legislation, as I just mentioned a few minutes ago, to try to rein in some of the large nonprofit hospital systems. What we're seeing legislatively on that particular effort is requiring more transparency. What are some of those large hospitals doing in terms of spending on an annual basis on community benefit? What are some of the large hospital systems doing when it comes to spending on charity care? Essentially, Congress is going to be looking for these systems to report data, if this legislation passes, report data that shows what they're spending on charity care and community benefit, and then also show what the tax break that they're not, or the tax break that they're receiving by not paying taxes. Essentially, it's prove your tax exempt status. Again, this is all about as a mean to get to lower healthcare costs. We'll see if it gets there, but I will also note when it comes to hospitals, why are they being scrutinized so heavily right now? There is a political element to this. And the National Hospital Associations have been fairly consistent in their opposition to some of the changes coming from this current Trump administration and from the current Republican majority in Congress. Hospitals were one of the leading opponents to the One Big Beautiful Bill, as you can imagine, and as some of you know, because of the level of Medicaid cuts. But when you think about your opponents who are trying to make your life a little bit more difficult, if you're the administration, you're going to come back after them. This is one of the ways that they're coming back after hospitals right now. Again, we'll see if it actually passes on top of the Medicaid changes that I've already talked about, but it's one of the explanations for why they're under the microscope. Now, I also want to point out that Senator John Husted, one of the freshman senators for Ohio, he has introduced legislation within the last couple of months to examine the business practices of hospital systems. His Healthy Competition for Better Care Act would actually scrutinize larger systems in terms of their contracting practices with health plans. And so this would prohibit certain contracting terms where hospitals can maybe force all of their providers or facilities to be in network for a particular health plan, or prevent health plans from being able to demand that certain providers who may be at a lower cost but also provide high quality services be part of a network. So this is a bill that the senator introduced. It's pending right now. I don't know if this bill will go anywhere, but it certainly fits the moment when you think about the politics of healthcare affordability on Capitol Hill, and also as one talking point that he can bring back to voters across the state, since he is on the ballot in November, and say, hey, here's one of the areas where I'm trying to do right by you by ensuring that you're not spending more for your healthcare premiums. Because, again, talking about drawing lines, he is drawing a line between some of these business practices with also the amount of health premiums that folks are paying here in Ohio. I will also note that there are conservative organizations from a policy perspective that are pushing a lot of these policies that I've described. When I talk about the Medicaid changes in One Big Beautiful Bill and also the scrutiny over hospital systems, a lot of this is being driven by a think tank, a healthcare-focused think tank that is conservative in nature called the Paragon Health Institute. They have some very, very sharp minds who are involved at Paragon Institute, very astute on healthcare policy, very clever in some ways in terms of how these policies are being drawn up, but they have the ears of all Republican lawmakers in Capitol Hill. So when we think about why is this happening, where are some of these policies coming from, the Paragon Institute is one of the sources of this for Congress. I mean, their fingerprints are all over One Big Beautiful Bill. Okay, I'm going to skip this for the sake of time. I see we have about 14 minutes left. And I'm going to move ahead to what is also being discussed in the halls of Congress right now, which is a third reconciliation package. Now, the first one, again, was One Big Beautiful Bill. The second reconciliation package is actually happening right now, and it deals with Homeland Security funding. You all heard about the government shutdown around Homeland Security and the impact it had on TSA lines in the airports around the country. Well, that shutdown is now done. Part of the reason why it's done is there is a commitment from Republican leadership to have a second reconciliation bill that would fund ICE and also Customs and Border Patrol. That is happening now in Congress and would be done probably within the next 3 or 4 weeks or so. But there's talk of a third reconciliation package, another party line effort that's coming. And this could have additional healthcare policies because Republicans are playing defense right now. When we talk about affordability, healthcare costs, One Big Beautiful Bill does not answer the question on that. So they need to do something to demonstrate to voters, particularly before November, on what other steps they're taking. This third effort might be that vehicle to be able to answer the question of, here are other things that this Republican Congress and this Republican White House are doing or have done to lower healthcare costs. So I'm thinking price transparency. I'm thinking more provider cuts, frankly, maybe on the Medicare side this time, not Medicaid. Also, reporting requirements for large nonprofit hospital systems that I described a few minutes ago. These are some of the areas where they might go if this effort takes off. There's no guarantees. So I'm not saying this is going to happen, but if it does happen, we might expect more healthcare policies to be part of it, and that would have a major impact, frankly, on the hospitals here in Cleveland area, the Cleveland Clinic, UH, Metro, down the line. So something that I'm watching closely and we'll all pay attention to. Also, we'll want to point out when we are looking at hospital systems, the 340B drug pricing program. This is an area where Congress has been really at its wits' end on trying to figure out what to do with this program. This program allows hospitals that qualify to be able to purchase drugs directly from drug manufacturers at a lower cost. The thought is that for hospitals to spend less on prescription drugs, and again, we know they're very high, the cost of them in this country, then they can take the savings of the lower drug prices that they're getting and then spread those savings across into other services for patients. This allows facilities to provide more care and also provide services outside the hospital walls. This program is loathed by drug companies because they figure some of the hospital systems are wealthy enough where they should not pay less or pay a discount for these drugs. So right now, this program is getting a tremendous amount of scrutiny on Capitol Hill and also within the Trump administration. From the administration standpoint, they see some of the larger systems that are so-called wealthier being part of this program, and they're being charged, and they're accusing these hospitals of using the savings to spend on executive compensation, so salaries for the C-suite, and other services that have nothing to do with patients. I think that's a stretch, but it is the messaging that has taken hold in Washington. So hospitals are also playing defense on this program right now. One thing to keep in mind, or a couple things to keep in mind. Number one, again, this is a transaction directly between drug manufacturers and hospitals that qualify for the program. Not every hospital will be part of it. When you think about that direct transaction, do you think taxpayers actually have a stake in that? Directly, no. Indirectly, it's a stretch to say it, but sure, you can draw some lines. So this program doesn't really have a significant bearing on the federal budget, but yet It is one of the most controversial healthcare policy items in Washington, D.C. So something to keep an eye on. Each of your major hospitals here in Northeast Ohio are part of the 340B program, or at least certain hospitals within their systems are part of the 340B program. Again, the program allows those hospitals to do more with less because, again, they're squeezing Medicare, they're squeezing Medicaid. This is one area that allows hospitals to be able to stretch what they're able to provide to patients and communities. So when we think about 340B, again, in a third reconciliation bill, if it gets to that, what could Congress do? Well, they could actually advance another Medicare cut, in this case, for the administration of these 340B drugs in hospital outpatient clinics. That's where a cut could be coming from, and it's a cut that the Trump administration tried in the first term. It was in place for about 4 years, but the Supreme Court overturned it because the Trump administration did not implement it in the right way. They're trying to do it the right way in this current administration, but Congress could just step in and legislate that cut, and you don't have to worry about the legality of it at all. So that is something that we are paying attention to between now and the end of the year. Also, I talk a lot about where Republicans are in scrutinizing hospitals, but let's not forget that Democrats are also very anti-big business when it comes to healthcare in many cases. And right now we're seeing various reports and products put forward by think tanks on the left that would influence any Democratic, say, administration, or if the Democrats were to take over control of the House or the Senate. So what's coming from the right is also coming from the left. So for hospitals that are thinking, hey, if Democrats flip Congress in November, the pressure and the heat will be off, not so fast. So just a reality check. Finally, just want to spend a couple minutes and talk about the midterm elections. I mentioned at the very beginning of this presentation, there is a very, very slim majority for Republicans in the House of Representatives, and they have a little bit more breathing room in the Senate, but it's not a large majority there as well. We're seeing these major flips, it seems like every couple of years. Democrats can take control of the House and the Senate. 2 years later, it flips either one or both chambers to Republicans. Another 2 years, another flip, back and forth. There was the expectation that Democrats would flip control of the House coming in November. Again, the political environment around inflation and healthcare costs is such that Republicans are on defense, Democrats are on offense, and they were thinking of a very good outcome come November. However, that's up in the air right now. I'll get to the reason why, but the environment right now for Republicans are very, very tight on Capitol Hill, including in the Senate, where there are a few key races that Republicans are looking to hang on to, including the Senate race here in Ohio, where Senator Husted is running against former Senator Sherrod Brown. That is one of the toss-up races in the country, one of the tightest races in the country. I understand Senator Husted has a slight lead in the polling right now, but it is very, very, very narrow of a lead. But this is one of the races that will determine control of the Senate come November. Taking a look at the House, in Ohio, there was redistricting that has changed the maps here, but you do have one toss-up race in the Toledo area, actually that stretches not outside of Toledo as well, but Marcy Kaptur, who's been in Congress for over 30 years, she has a very, very tough race to hang on to her seat. She was able to survive 2 years ago. We'll see if she'll get through this year. That is the only toss-up race for the state of Ohio. Again, Democrats were thinking that they would have a good day come November, but however, there are a couple of situations that have changed the calculus, and right now it's not a guarantee that Democrats will flip the House. The Supreme Court essentially took a knife to important elements of the Voting Rights Act. And so what you're seeing here is that there is now a race for many state legislatures, particularly some of the southern states, to redraw their maps as a result of the ruling from a few weeks ago. I am not a lawyer. I am certainly not an election law expert, so I can't really explain to you what the Supreme Court did, but what the result will be is that there could be the potential of Democratic seats, safe Democratic seats, essentially drawn out of, the Democrat who holds those seats will be drawn out of Congress based off of these new maps come November. And these changes will be implemented very quickly. And so you're seeing states like Tennessee, South Carolina, Louisiana, Mississippi, Alabama, Florida, all states that are looking to redraw their maps as a result of this ruling. Democrats tried to redraw maps as well. In California, they were successful. They were successful through a ballot referendum in Virginia. However, the state Supreme Court in Virginia overturned the new maps for the Democrats. So the Democrats are looking at a net loss because of redistricting. And this is why there's no guarantee that the House will flip in November. The only way that the House flips, in my opinion, is a wave election. The conditions are ripe for that. So we'll see if voter concerns around healthcare costs drive such voter discontent that regardless of these redistricting changes, Republicans still lose at the ballot box come November. We shall see. We don't know, but the situation is not clear as it was earlier this year. And I've already talked about a little bit of the redistricting in Ohio, so just wanted to note all of that. So I think I'm going to stop there. We have a few minutes left and just see if any folks have any questions. My last 2 slides are around AI, and I can answer any questions around AI, but let me just stop there.